changing lives.
Hello and good evening. It's a beautiful, beautiful, beautiful pink month, and it is the month of October, where we talk and discuss everything under breast. I'm sure you are there and you are like, Efia, today two breasts, why? Yes, there is a need for us to talk about breasts. This organ fed you, and it is still feeding people, and we will continue to use it till thy kingdom come. So for us to make sure that that organ is safe and is well managed, then it means that we need to study something about breast. The month of October is Breast Cancer Awareness Month, and that is why we are all in pink, saying that we need to know what breast cancer is about and find ways to take actions to resolve or to end it. And that is why we are all talking about breast. And today's episode, we are talking about breast care and its significance. Yes, breast care and its significance. I am Efia Sewa Mansa, and you are watching Love at Home on Hope Channel. Please, you can join us on Facebook, on YouTube. You can call your friends, your family to be by their set as we come to unlearn and learn on breast. Let's go for a quick break. When we come back, we start the discussion. We'll be right back. Please stay tuned. Thank you.
Ezdia Safwa e working as Adi in field to 55 years.
Team, I will go proclaiming his advent.
Yebedi Juma de Bebre, and some program Ankasa do ebite say root match, clean up exercises over coso, musical concert, Bible quiz competition, sports, and many more. On the 21st of October 2023 is the Grand Deba at Ahafo Kenyase number 2 DA Girls School. Guest speaker, Pastor Dr. Kwame Ano Boahen, Pastor Maswell Intimenchi, Pastor Emmanuel Kusiapia.
Yanunti yaton safre achichini benche yafo nyina.
Yaton safre atitiro bebra wonsu di mo akotrepa. Special guest of honor Nana Kobra Isia Ababio.
Nana Osei Kofi Abri.
Guest of honor Honorable George Yawache and Honorable Patrick Bano. Honorable Anthony Mensah.
The new befriend you took on so ebewi and yom sadan.
Yanunti yaton safre adofo wa fakenya asafo mu bibia wo bia for wa hoden any winning die. Any usika fa bebo programming na yankopon bishop. Kayo kai say asoro dan yenwie ye yanunti ye nyina ye de yesika eva bebo mu na fe ye de aboa amajuma die no akos. Na eda no ampaya ebedwa.
Thank you so much for staying tuned, and you're welcome back from that commercial break. Let me remind you that we are discussing breasts and family in the month of October, and today we are looking at breast care and its significance. Yes, breast care and its significance. Please do not forget to call in the family members that time has soon. Yes, it is Love at Home. Let them come sit so that we learn and unlearn. And to say a very big thank you to Angel of Hope. Angels of Hope, thank you so much for sponsoring all the shows or all the programs on Hope TV. Thank you so much. Thank you. God bless you. You can be a member. Please join them and you will be blessed. Today, I have a very beautiful lady and a very handsome gentleman. And they are all repping in pink, telling us that something is at stake. I have with me Mrs. Ophelia Sewa Tonto. She's a women's health specialist. Mami Ophelia, you look so beautiful.
Thank you.
And so hot. How are you?
I'm fine, thank you.
Your day?
Yeah, it was busy, but it was cool.
Especially in the month of October, I can imagine.
Yeah.
People were bringing their breast there.
Yeah, I have to go to a church to talk to them. And
Hey, so you were pressing breast today?
I tell you.
You've enjoyed. You are welcome.
Thank
You're welcome.
you.
I'm so grateful that you were able to join us. Now, my other special guest is Dr. Emmanuel Boache. He's a medical officer. Dog.
Hi.
I can see you are tired. Have you also been pressing breast today?
Today, no.
Not yet. But I'm sure soon and very soon you will.
It's almost tender, so today, no.
Okay, so we welcome you to Love at Home, where we discuss everything under family, from parenting, from raising children, from husband, wife, money, everything on this show. It is a family show, and that is why we see it's so important that in the month of this October we talk about breast, which you and I were fed from. You agree with me, right? Sure. All right. So thank you to you, my lovely viewer. You are welcome. Do not leave the dial. Remember to share, like on Facebook and on YouTube. Now let's start with our discussion. We see and we hear breasts. And we see on both male and female. What is it? Let me start from you, Doc. What is it at all? What is what we see? What is it?
Right. So what is breast?
Or in a way, define breast.
Define breast. If this was an example, I may have failed.
You see?
but then this is something I can say about breast. Every human has two sets of breasts or two pairs of breasts. It is situated on the upper part of the chest, just in the middle of if you are to divide your neck to your shoulder, in the middle of it, you find it there. There are some people who may be born with an extra breast, which is an anomaly. But then for every normal human being, they possess two pairs of breasts. They grow, they develop, they mature based on changes in life. So normal growth may be a precursor to the breast increasing in size. Some conditions like pregnancy, lactation can lead to it increase. In fact, puberty is one of the growth spurts in which we see an increase in the size of breast. And then lactation can also lead to it. These are normal physiological mechanisms in which the breast grows and then develops. But then it may get to a point where medical conditions like some diseases may also influence the breast and then lead to changes. So this is what influences the breast. In males, I always say physiologically the breast in males has no function. It does nothing. Maybe just part for cosmetic purposes, for aesthetic purposes, you may need it to show that you're a male. Okay. But if you're a male, you possess enough breast. It is an anomaly. We call it gynecomastia. Okay. It is an anomaly. Right. There are some genetic conditions which may also predispose a male to having some abnormal sizes in breast, but abnormal meaning quite big, one of them being Klinefelter syndrome. Okay. So this can also influence breast in males, because for a male, you don't need breast for anything. I think we become to the functions, so I don't want to go there. So basically, this is something I can talk about the breast. It is something that is part of us, and it is something that we should also talk about it.
Okay. So doctor is telling us that breast is also like the ordinary organs that we have. How true is that?
Okay, so actually the breast forms part of our reproductive system. So when we are talking about reproduction, the breast is part. And one good thing is that the breast development is progressive. It starts once there is fertilization in the womb. So once
you mean before the person is born?
Yes.
Okay.
The development starts right there, and it continues. So it goes through and through. So it does not start and stop. When the development starts and it's impeded along the way or it stops, it means that there is a problem. So along the line, when we are talking about the breast, doctor mentioned some, so that we see our young girls in the family, see that they at their stage, they have just flat chests. And sometimes we find it difficult, especially to differentiate between the boys and the girls, the breast in it. But as they grow, getting to puberty, the boys' own will stop. That's why doctor was saying that it does not really have any
Cosmetic.
Exactly. But for women, from puberty, there is more changes that keeps on in the breast. So we can talk about the 10 stages in the breast development of the women.
I'll come there.
Okay.
I'll come there because I know we will need time for you to explain all the stages for the development for us. Now, what is it made of? It's so soft, so nice. What is it made of?
Right. So the breast, it's quite interesting when you are to open it up and see what it is composed of. So it is mainly composed of fats.
Fat.
Yes.
Wow.
There are no muscles in the breast tissue.
Hey.
It is fat. So the fat is what gives rise to the shape that we see. But then within these fats, there are lobules or lobes which produces milk. There are ducts which are more like pipes in which the milk has to pass through. And then there is the outer skin that we see. And then just beneath the breast, so between the chest wall and the breast is a muscle tissue. Okay, so the muscles are part of the breast. It's what the breast sits on. That is what the fat, the lobules, and then the duct sits on. And then on the outside, you see the nipple. You see the area around which looks a bit dark compared to the nipple, called the areola. And so that is basically what it's made of. It is basically fat.
Hey. I see. Okay. Now, Mami Ophelia, at a point we see that breast enlarges, especially in the female. So now I want us to look at the developmental stages as it is growing and it is, when it is enlarging, the stages.
Okay. So in adolescent girls, actually breast development precedes menstruation. And the girl child will start to develop breast averagely about 3 years before she will get her first menarche. So for the pre-pubertal stage, you see that they are just flat chest. There is nothing on it. You see those small pointed things on it. But as I said early on, the development has already started in the womb or in utero. So it progresses. That is the first stage when we see the flat. At the second stage, we see that like there is a bit of protrusion, or it becomes a bit bigger. So usually in the olden days, our mothers would say that, oh, when you're major, that kind of thing. I really hear my grandmother usually say that.
Yeah, major.
Yes, so at that point, it starts the development. Then at the third stage, you see the areola. But around that time, the areola, that's the dark area around the nipple. It's darker and it's, let's say, concentrated to one side. And we see the shape or the papilla coming out a bit. At the fourth stage, you see that the areola spread, the darkened area regresses or recedes, and it enlarges in a way.
You mean the black around
area
it tries to expand?
Exactly.
Okay.
It tries to expand, and the breast starts to form shape. So you see it increasing in size. At the last stage, you see that the shape is fully formed. And the nipple is pointed, the areola too have recessed. So around that stage, you can say that the breast has gone through all the 5 stages in simple terms.
Okay.
The breasts have gone through the stages. But notwithstanding, that is not the last point of it. Breast changes keeps on at each stage of the menstrual phase. So that around the menstrual cycle or the ovulation cycle, there are some changes too that goes on in the breast. So there are some women that will feel heaviness around the time of ovulation. Some will have that tingling sensations. Others too don't even want their breast to be touched because they have some sort of pain around that time. It is some of the changes that goes on. Also during pregnancy, the breast too goes through a lot of changes because it's a reproductive organ. You see that the breast becomes heavy, the size also increases. Around that time too, the areola becomes more darker. Then we see some small spots, we call it the Montgomery tubercles around it as well.
Around the darkened area.
Exactly. So there are all signs that if I see you and I see your breast, even if your tummy has not become big, I can say that, oh, this woman is a bit pregnant. There are some of the signs of pregnancy.
Okay.
Also, through the stages too, during lactation too, you see that there is some changes too that goes on, because now the ducts or the structures that doctor was talking about, they start to produce milk. The milk is stored and it's being released. So there is heaviness around that point too. And also during menopause, the size of the breast also regress. So now
it reduces.
It reduces during menopause. After you have stopped menstruation, the size will reduce, it becomes flabby and all that.
We don't want that one.
Definitely, it's a stage. So we'll go through it. So those are some of the changes that goes on.
Wow. Now, Doc, the size, when we see the size, sometimes it's so attractive. What brings the attractiveness to it? Why?
All right. So
because I'm saying that because you hear some women saying, my breast is too small, this one is big, and sometimes among same age group, they are confused.
Right. So this is a very good question that we need to explore. So breast changes is under the influence of hormones. Okay. So without the hormones, there won't be any differences. The reason why at a point male breasts stop getting bigger is because there is a swap in the concentration of the hormones.
Okay.
So when the male is approaching puberty, testosterone levels increases, and then estrogen levels drop.
What is the use of the estrogen level?
I will come to them, right? So once the male hormone has risen, that is when they may start developing what you call secondary sexual characteristics. Okay. So the voice will become a bit deeper, will have more masculine features, and then the chest will be broader, and then breast development stops. And of course, there will also be the time that they'll start producing sperms. Okay, right. So after this, all male development is under the influence of more testosterone, less estrogen. Okay. Now, the converse is what happens in women or in females. At that point, estrogen surges, testosterone rises. Yeah. If a female at this point has the converse, meaning testosterone rising
more
compared
than
to
the estrogen.
Compared to estrogen, that is when they also tend to look more masculine.
Yeah.
Okay. And so they may have those changes, physiological changes. But normally in females, it is the estrogen which goes up. And that is what makes them have that finer shape, that finer appearance.
I like the way you're saying finer.
More feminine, more sweet voice, and then you see the breast protruding. And so when we see these changes, and in fact, pregnancy and menstruation are under the influence of these hormones. And so when you see these changes in a female, it means the body is getting ripe for pregnancy. It is getting ripe for lactation. Okay. And so she mentioned something that even during ovulation, the breast gets more thicker. Yeah. It's part of the body's preparedness for conception to take place. Yeah. And so if it doesn't happen, what happens? The hormones go down and everything regresses to normal, okay, or to pre-ovulation stages. So when we see these changes, it signifies that if you are a parent and you are watching us, it signifies that at that stage, your child or your daughter can get pregnant. Most of the time, we delay in having sexual education with our children. If you are watching this program at this time, make sure at this stage, when you see those signs, start sitting your children down and start telling them, you will get pregnant if you do this. They know them already, but let them know that you also care about them. And when you see them also having their menarche, which is their first menses, again, sit them down and speak to them. Sometimes some people may not even it does happen that menarche may delay, and then before you see the person is pregnant. So don't close your eyes
Right.
or don't be oblivious to
Waiting
these
for the
changes that
mention.
you may see. As soon as you see your daughter or your son looking more pubertal,
Yeah.
sit them down. And have-
Based on the characteristics you have
Ye-
just mentioned.
Yes, the boy looks more masculine, the lady looks more feminine. Sit them down and speak because the body is telling you it is getting ripe for adulthood. There's a transition and it is getting there.
Wow, this is interesting. My lovely viewer, let me remind you that you can join us on Facebook and you can also send in your questions to 0559-680066. 0559-680066. Doctor and Madam are here. They will help us with any question that you want to know. Now, what is the significance of the breast?
All right, I love this question. So for the significance of the breast, the first thing is to help us with our femininity.
Okay.
So once, as doctor was describing, you have that fine breast.
Oh, you
the
seem
si-
fine.
Because the breast is fine.
It's fine. Okay, you are here.
So when we have that, we say that it gives us more female characteristics. We look more feminine. So we see that the breast, it's something. We can differentiate between a woman and a man. Another significance of the breast too is for breastfeeding. So that you rightly said, we're all fed with it. Is to help with procreation, to feed babies, and to make sure that they have the right nutrients at the right age and at the right time that they need it. Also, another significance of the breast is for sexual pleasure, because we have the nipple that have that erectile tissues that is very sensitive, that helps with sexual arousal. And sometimes it's not only in females, some males also have that capability or the erectile sensation, it's there. So basically that is the significance of the breast. So it gives us our beauty as women. We also be able to feed our babies, and also it's all with sexual activities as well.
Doc, do you want to add something to the significance?
Yes, there is a social aspect to the presence of breast. You subtly mentioned it or asked about it. That is self-esteem. Okay, and we shouldn't forget it when you are discussing breast. There are people who are so much engrossed in how their breast looks like that they want everyone to see that they have it. So when they are dressed and they are stepping out, they have to show some cleavages and some flesh. It gives them that confidence that this is who I am. And there are some who are so much depressed about their size. Their size is that they think they are either it's too much of a burden, or they have
too little
or too small, and they are never satisfied. And they may not tell you, but deep down within them, it draws them away from society. And so this social significance is something that we cannot discount. I once had a patient who decided to die with her two breasts. She had a breast cancer. She was advised to take one off. So, nope. She would rather keep them and die with it than lose one.
Your body integrity.
Yes.
Nice.
That is how much she valued her breast.
Wow.
Okay. So she wanted to keep all of them intact, because to her, that is what makes her feminine. You are taking one. And this is one of the most crucial issues you have to deal with when you have to take one breast out. You forget all the medical aspect and you focus on the psyche. So you psych the person up to know the change that is going to occur after the procedure, and then they have to get used to it before you even take them to theater. If you fail this, you may force someone under the knife, and then the person comes out depressed for life. And so socially, breast plays a role, and men like it. Men adore it. When it is a sexual bond between a male and a female. This aside, in fact, breast cures depression.
Oh, doctor is saying it.
Breast right, breast cures depression. Right, so in fact, there is studies underway to, as it were, find out whether the hormone that is released from touch can be developed to as a way of managing depression.
Okay.
When you hug someone, when you touch someone, there is a hormone that is released. We call it oxytocin.
Yeah, the happy hormone.
A happy hormone or a love hormone.
Yeah.
Oxytocin does so many things. One of them is it aids in labor.
Okay.
So if a woman is having difficult labor, is not progressing, we can put an oxytocin on the person, the cervix will dilate, it will expand, she will have a safe pregnancy. So in medical, so I've even learned something, that if a woman is having trouble delivering, just get the husband to the labor ward, let her hug the woman. That is natural way of boosting oxytocin levels, right? Okay. So when you, this is for married couples, so let me just state the caveat before the church come on me. Right, so if you are married and your wife's breast does not intoxicate you, doesn't satisfy you, you've never hugged your wife before, you've never touched her breast before, you are losing out. Okay. Because it facilitates bonding, and the more you touch, the more you get that oxytocin coming out. Yeah. And oxytocin has been shown to reduce stress level. And depression. Depression, anxiety. Hug your wife. Yes, exactly. Okay. And as Proverbs say, let her breast intoxicate you. Play with them.
Doc, you are leading me. Okay, you are leading me too much, because we are going to talk about that later on. Right. Now, let's go for a quick break. But when we come back, we are going to look at how we can safely take care of our breasts. Now we are talking about breast cancer. How can we take care of the breasts? Let's go for a quick break. But I'm reminding you, you can send in your question, your suggestion, to 0559680066. We'll be right back. Please stay tuned. Thank you.
Hi, do you know that alcohol is the most abused drug on earth? Do you also know that smoking a cigarette may take 11 minutes of your lifespan? Do you have someone who is psychologically deranged or mentally ill? Do you know that 1 out of 4 women is abused daily? Do you know that now it's common for children under 12 years to smoke and drink? Do you know someone who is addicted and is struggling to overcome addiction? Then there's a good news. The Wounds of the Heart is bringing you qualified practitioners, personnel who understand certain situations. We meet them in their offices, at their homes, at their comfort zone, and right here on our studios. Make a date with me this and every Wednesday at 4 p.m. right here on Hope Channel.
Every individual has a story. Stories of social issues such as infertility.
You did not marry your wife only because she's going to give you a child. You married because you loved her. Whatever comes on your plate, you're ready to accept that.
Abuse, obesity, life struggles, and others can be very frustrating. That is why Real Talk is back again with another exciting season where individuals like you can come into our studio or join us virtually to share your story and experience. To share your story, you can reach us through our WhatsApp number at 0559 680 066, or you can email us at hoptvghana@gmail.com. We say don't lock them away. If you ignore them, they can just get angrier and louder.
Hello, thank you so much for not leaving us. We appreciate you. Thank you so much. You're welcome. And we are discussing the month of October. We are talking about breast, the family, and then the breast. But today we are looking at breast and its significance, what important it is, and why it is important. And now we want to look at how we can take care of this special organ. Now, let me start with you, Mami Ophelia. You were able to tell us what the breast is made of and how nice. I remember you kept on saying, using the word nice. Now, how can we take care of this organ? Because breast cancer is on the increase. Now, it's not only the oldies. You have young people coming into it. Sometimes I hear the men are even getting some. How can we take care of our breast?
All right. So taking care of our breast is very important and it's crucial for every family, let me put it that way, because when a woman or a family member is affected, I think mostly what the family physicians will do is that they'll call the whole family because it's going to have a toll on each and every individual. The first thing we can do to take care of our breast is normal bathing. We need to bath each day, paying particular attention to our breast during the process. At least those who have enough breast, as we were saying, that some have small, some have medium. So no matter how your breast size is, make sure that you are able to bath the under every part of it with just normal water and soap. That is the first thing. The next thing is that you should be curious, or you should be particular to do a regular breast self-examination. The breast self-examination is when you, the individual, at every month, either after your menstrual period, or if you are in your menopause, you just select a day that you remember each time to examine your breast. And with this examination, there is the looking aspect, that is the inspection. So you look at both your breasts to see if the sizes are the same, is the skin the same as usual, or there are some changes in the skin. The nipple, it should be pointed. Is it pointed or it has retracted? So you are looking for obvious changes. After the looking, you do palpate. And with the palpation, you are palpating to find out if there is any abnormal lump.
If you say palpate, please break it down.
So the palpation is just using the parts of your fingers where I'm trying to touch. So you send one of your hand, the other hand at the back of your head. Then with the parts of your fingers, you start from the armpit. Because the breast tissue extends to the armpits. So you are palpating to find out if you find any hard, regular mass that is round, very hard, is not movable. If there is anything that like that in the armpit or in the breast, we say it's a lump. So if your breast is in the normal size, you try, there are various ways of doing it, but you can go around it. You do the light touches. So we say light palpation, just to find out if there is anything immediately beneath the skin. You are going around it. Then you do a deep one. The deep one, your hands become more firmer. The parts of your fingers, it becomes more firmer. You start from the armpits, you go round the breasts in that circular motion, around, up, until you are able to cover the whole breast. Then you gently squeeze the nipple to find out or to check if there will be any abnormal or normal fluids. Sometimes if the woman is breastfeeding, you get some breast milk coming out. But if the color of that fluid, it's brown, red, or you cannot even differentiate it, it tells you that you need to see a clinician to examine and to find out why that color. So that is one way of taking care of the breast. The other way of taking care of the breast, it's also by exercise.
You mean normal exercise?
Yes, but this one, you are doing exercises that helps with the upper chest, upper parts of your chest. So like planks, some push-up, it helps to tighten the muscles around that area and give the breast a firmer breast. Those who want some of more, let's say, a lot of firm breasts, they can use the dumbbells. Those round dumbbells to do those exercises to help them as well. So there are actually exercises that will help to make sure that your breast is firmer. We can also do some massage.
Massage?
Yes, massaging the breast. So with the massaging of the breast, you try to start from the upper part of the breast So initially, you gently squeeze it down to the nipple area in a firm lotion. Can use a normal shea butter or any massage oil that will be applicable. So you try to squeeze or massage the firm area down to the nipple. Then when you come beneath the breast, you cup it and you massage it gently for it to be firm. Some school of thoughts believe that traditionally we try to back our children and with the cloth that we put there. Some school of thoughts believe that it's also weakening the muscles over there. That is why we have the lax. So they were advocating that we try to hang them as some outside countries do it.
Yeah.
So that is one. Nutrition too is very key in keeping our breast. Eating foods that have a lot of antioxidants are good. Seeds and nuts are good. So like if you are eating cabbage, broccoli, they are very good kale.
Okay.
They are very good for the breast and for the whole body as well.
Okay.
Then seeds and nuts.
Okay.
So most of the seeds have omega-6 fatty acids that are also good. Also making sure that your diet is adequate. I don't want to say balanced, but I want to use the word adequate, which means that the work you are doing and the food you are eating
is commensurable.
Exactly. And also trying to make sure that your weight is checked in balance so that it helps you in your breast care or your breast health. If you are overweight, it comes or is associated with a lot of challenges and healthy conditions as well. So it's important that you check your weight as well.
Okay.
And with our braziers, we have to wear a brazier that is fit for our breast size. So if you have a big breast, get a brazier and a cap that will fit the breast size. It should not be too small or too big. It should be with your size, and the material that we are choosing for should be also be of a good material. It should not be too much. It shouldn't be a material that cannot absorb sweat and heat.
So we are talking about cotton.
If we can. Most cotton or the polyester shouldn't be too much because sometimes it's difficult to get the cotton 100% cotton. So we should also be mindful of that. Then if you are breastfeeding, you can get a breast bra. Now there are some braziers that are also designed for breastfeeding. If the breast is too heavy and you occasionally feel pain, you can get a sports bra to support your breast. It's firm, but that one is a bit lax and does not give you that tightness or that pain. So choosing the breast too is key. Then we will say operation one brazier one day. The brazier should be worn every day. You should change it.
Okay.
You should not wear one brazier for the whole week.
Okay.
You need to change it and you need to wash it as well. Because when it's dirty, it has a lot of some microorganisms and the dirt. Also, even the smell around you does not help. So you have to change the brazier every day.
Wow.
You need to change it. It's part of the breast care.
Okay.
Then also, we should make sure that as part of caring for our breasts, we are also well hydrated.
Taking in more fluid,
taking in
water.
more fluid so that the dryness sometimes around the areola, the nipple will reduce as well. So these are some of the ways we can take care of our breast.
It's a whole school. So it's not just enough just getting up, bathing, then off you go. It's not enough.
Yes, sometimes it's not enough. You need to do more.
Because here you've mentioned dieting, you've mentioned exercise, you've mentioned
the
massage, you've mentioned a whole lot of things. Now, Doc, do you want to add something? Oh, she has said it all.
Right, she said virtually everything. So as we established at the foundation of the discussion, the breast forms part of the body. So everything that will keep the body healthy will also keep the breast healthy.
Okay.
Anything which will injure the body can also injure the breast as well. So caring for the body, caring for the breast goes on. That's why she mentioned exercises, she mentioned diet, she mentioned
bathing,
hygiene
and all that.
In the hygiene aspect, you talk about regular changing of the
bra.
brassiers and all that, and maintaining an ideal weight as well. So these are all parts of the breast care. This is because if there are to be any diseases of the breast, normally the factors can be grouped in two.
Okay.
Those you can control and those you cannot control. For those you cannot control, one is being a female. If you're a female, even if you do transgender, you are still a female. Okay. So you being a female, your risk of developing breast-related issues is very high compared to a male.
A male.
If you are a black, your risk of developing breast-related conditions.
Why that one?
We don't know.
Maybe probably the genes.
We don't know. So these are things that we don't know. Studies have shown that if you are to take a number of people who have breast cancer, most of them are blacks. What is the explanation? We may not know. Okay. The other condition, if you have a parent or a sister or a twin who has had breast cancer before, your risk is high. Why? We don't know. They may be due to some genes that you share or so there are some of them that you don't have control. But for the things that you have control, that is the things that she mentioned. And let me add, alcohol and smoking. If you are watching us and you would drink alcohol, you smoke, your risk of developing breast cancer is high. And this is quite difficult to say, but I have to say it. In fact, pregnancy, irrespective of the outcome, is a protection against breast cancer. So whether the pregnancy ended in delivery or ended in abortion or miscarriage, it means at a point in time there was a cut in the hormone that
couldn't finish the cycle.
Yes. So when there's that break, the body goes on recess.
Okay.
If there's unexposed or uninhibited estrogen exposure, probably you got your menses quite early in life, and then your menopause was very late, and there was no break. Your risk is very high. So
if you said there was no break, what do you mean by that?
So so the break is when pregnancy comes in, or lactation comes in.
Okay.
And then breastfeeding actually also prolongs the return to menstruation because of the action of a hormone called prolactin. Okay, so prolactin will inhibit the process of menstruation. So once a woman is actively breastfeeding, menstruation is kept at bay. From the time that the frequency and then the intensity drops, that is when the body starts going back to the clock and then restarting the menstrual cycle. So if you are married and you think you are delaying childbirth, you are putting someone's daughter and you are putting your wife at risk. Get her pregnant. Okay, so that you also protect also protect her from developing breast cancer as well. And then I mentioned alcohol, I mentioned smoking. So if you're also watching and you drink, you smoke, please take this opportunity. If breaking it is too hard, see a psychologist, see a psychiatrist, and let them guide you on how to break it.
Mami Ophelia, you see the type of braziers these days we have, you see that sometimes you see some which has metal inside the bra. I don't know what the purpose is, maybe to make it stand, or I don't know. How is it harmful to the breast?
Yeah, I think I read one research that they were saying that those metal braziers are not the best because of the heat over there and the emissions it makes. But actually, I think research is still ongoing. But the main idea is to give the breast that firm support and give it a little facelift so that at least...
You are using the term.
All right, so that at least it will be where we want it to be. So even with that, you see that some braziers too are even padded on top of the whole thing. Exactly. So those are research that are ongoing to give us a clear cut. So to a large extent, we cannot say that it's bad or it's not bad. We need to research more on some of these
findings that we see.
Exactly.
Okay. Now, Doc, same with the breast and the taking care of it. you've mentioned exercising, dieting, and all that. We see that some women try to, I don't know, try to expose their breasts. And I don't know, to the naked sun. You see sometimes what we wear, see some parts are showing, with the exception of the nipple, the whole part is outside. Does the sun rays has any effects on the breast directly and all that?
Well, sunlight is good. If someone says sunlight is not good, the person is lying. But we understand temperance, and so we should be able to appreciate what kind of rays we should absorb. The type of sunlight that beat us in the village, the one that will even cause you to have baldness, because it will directly be shining against your scalp. That is not good. Okay. So if you're exposing yourself to that kind of rays, you benefit nothing. In fact, you will rather provoke the body to respond aggressively, and then you may end up having some cancer of a sort. It may be skin, it may be other cancers. But then the early morning sunlight and then the late sunset rays, that shines. If you're able to absorb it, that one is good. But when we see women working during the day and they are showing some flesh on their chest, I don't think it is for them thinking of even absorbing the sun ray. It is to trick someone's son or someone's husband, or as a way of, as I mentioned, showing people that
self-esteem.
They are there. I have come. It is my time. Okay. So for them, it gives them self-esteem among their cliques, among their circles. But if you're a rational being, you are not going to do that.
Mama Ophelia, you mentioned that we should take in more fluid. And sometimes we keep water in a bottle, then over so many days, or sometimes it goes through some harsh condition on the weather, then we absorb. Does it have any correlation? Hot things in plastic things. You read certain things, certain articles, and they are trying to advise us not to be taking or to be using containers like that. What is your take on such things?
Yeah, I think now research is showing, especially when you have a bottle of water and you leave it in your car overnight, because of the emissions and the radiations from the car and other atmospheric conditions, it's not good to take this water. And mostly you see that the trucks that goes around to supply our pure water or sachet water, they don't cover it. The sun's emission is right on the water as they travel along. That one does not help. So as much as we can, even when we are buying, we should be circumspect to the places where we buy and where those water is kept. And if you have any bottled water or any water that is left in your car, the next day you don't have to drink it. You just have to discard it because of the emissions and some of the chemical reactions that goes on. Okay.
So when I see any lump, or when I feel there's a lump, or I feel any irregular thing, does that does it say that I have breast cancer or what?
So the straight answer is yes and no. Okay. Okay. So most breast lumps are benign. They are not cancerous. Okay. In fact, there may be cyclical breast lumps with each menses. So just around the time of ovulation, menstruation, if you touch, you may feel something. After menses, you touch, you don't find it. Those ones are most of the time not cancerous. To diagnose that this is cancer, in fact, so whatever lump you see, don't keep it to yourself. Let a doctor assess it. It will be sent through different processes from scanning to probably a surgical removal, and then a microscopic analysis of it to see whether that lump is cancerous or it wasn't cancerous. But most breast lumps are not cancerous. Whatever it is, know yourself, touch it, feel it, let a doctor assess it, and then a decision on it will be made. And whenever you see anything, don't keep it to yourself. Just the story that you shared about your friend, if she had spoken out, help may have come speedily for her. But then she kept it to herself. But by the time maybe it was diagnosed, it was too late.
Yeah, it's because in Africa, we think everything is about spirituality. I mean, suspicions and all that. So this lady thought that a friend was trying to come into the marriage, so the person bought, in quotes they say, what Yariana Mano. Apparently it was breast cancer. And he was sitting at a prayer camp, praying. At the end of the day, my friend died. As a colleague at work, and I still remember her so much. He left a beautiful boy. So I know these issues are there, but how can you advise us? But before that, I have a question for you. Somebody is asking if false braziers, are they good to be used? Mami Ophelia, you have to answer this.
Okay. So mostly, ideally, if we can, some of our underwear should be new. It shouldn't be something that somebody have used and will go and will pick it up. So as much as possible, we should get a brand new brazier so we don't have to use the false braziers. So that is my take on that. Okay. As much as possible, every undie that you are wearing should be brand new.
As much as possible. So if the person cannot get to the new one, maybe you should put them into disinfectant after,
right, normal washing and sunlight
will do. Okay, so the way we keep our braziers, washing them, putting them under the sunlight is enough. Now we see women using so many types of cream, different types of cream. Does it have any effects to the breast? Can it help get breast cancer or something? The types of creams some women are using?
Yeah, I think some of the creams have some chemicals that are very strong. So maybe it might not lead them to have breast cancer exactly, but they can have some skin cancer, especially those that are high in hydroquinone. Those one can lead them to have other cancers. And you know, cancer, it's so funny. When one aspect of your body have cancer and it's not diagnosed and treated early, it can spread to other parts of the body.
Really?
Yes.
Okay.
So it's important. So as we are talking about taking care of the breast, our main goal is for early detection. Because if we are not able to detect it early, that is where it becomes difficult to tackle it. But breast cancer is killing a lot of women. But those that are diagnosed or those that are detected early, they get help. And mostly we get people surviving breast cancer and sharing their stories. So our key thing is that know yourself, know your breast. What are the changes that occur at each point? If I'm menstruating, what should I expect? And you see, it's a family thing. There are some men that they really know their wives, that when they touch the breast, as doctor was saying, they hug. They know that they are in that month of that time of the month, and they will not even get closer. But some women don't even know ourselves. Like the brasa is I was asking, if you should just give in a phone-in call that you want people, you see that a lot of women don't even know.
Some will have to measure like this and take her to the market and bring it like that.
Yes, they don't even know our breast size, and it's something difficult. So we should try as much as possible to get these informations and also know the right thing. The earlier question that you were asking, now there is a lot of help. So if you see that there is any changes, don't be in your room or at your one corner trying to solve it all by yourself. There are a lot of people who are ready to help you. So that every hospital, even if you are not sure, when you get to any midwife, the midwife will be able to assess your breast for you. But if you are having a peculiar problem, you suspect it's a breast cancer, you can go to Rich Hospital, that's the Greater Accra Regional Hospital. You can go to Kolebu, you can go to 37. But before that, any district hospital that is closer.
Wherever in Kumasi,
in Accra, in Kumasi, any hospital, any district hospital, even the health centers, there are midwives there. So they will be able to help you to do, let's say, a clinical breast examination. And the clinical breast examination is when a health professional, being it a nurse, a doctor, a midwife, or somebody who is trained it's examining the breast for you to identify if there are any abnormalities so that onward referral will be made. So it's important. We should also know that it's not all breast pain. A lot of people think immediately I have pain in my breast, then I'm dead, I'm having breast cancer. But that is not it. It's not all the pain that is as a result of breast cancer. Sometimes it can be some side effects of some drugs or some changes that are ongoing. So if you are not comfortable, if you are not sure, please
Go
see
to
your
the
family
hospital.
physician or go to the hospital.
Okay, Doc, please, your final words.
Right. So my final word to everyone, first of all, know your breast, whether you are a male or a female. There is a percentage of breast cancer which is attributable to males. So you cannot say if you're a male, you are
exempted.
You are exempted. You may be that. You may fall within that rare percentage.
Yeah.
So also get to know your breast. The second counsel I will give is there are some misconceptions, okay, regarding breast. So people think if you suck the breast, you are protecting cancer. It doesn't.
Exactly.
There's no studies which show that sucking of the breast protect against cancer. But then, as I indicated, it enhances bonding. Between couples, between two people. And so if you are sucking, it is not for protection, but to enhance the attraction and the bonding between the two involved. Let's take care of our health. The breast forms part of the human body. In males, it only plays just a sexual function because the nipple has sensitive nerve endings, whether in female or in the males. But the female have the other function of lactation. So let's take care of our health. Anything that will harm your body will also harm your breast. And finally, if there's any discharge outside the window of breastfeeding, so you are not breastfeeding, but you find a discharge from the nipple, it can be milk, it can be blood, it can be water, it can be anything. It is medically significant.
Okay.
It is telling you something.
Okay.
At that point, you may not know what is it.
Yeah.
But if you are not breastfeeding, you find these, let a doctor have a look. Okay. Even if you are breastfeeding and it is not make it, but it is blood, let a doctor have a look.
Yeah.
One of the things that one of the conditions could be an infection. Okay. Breast can also get infected. And when there's an infection, we call it mastitis. We have to treat it with antibiotics. And lastly, I always say this, but this is something to make people happy, that if you have any pain in your breast, most of the time it is not cancer. So if there is a lump and it is painful, or if there's any pain in your breast, praise God, it is not cancer. But if there's a lump and it is painless, run to a hospital.
Wow.
Thank you.
All too soon, we are concluding, or we are coming to a close on today's topic on breast cancer and significance. I'm sure you've learned a lot. Painless lumps, be serious with them. Go to the hospital. And the good news is that you can visit any medical facility where you have the midwives, the nurses, anybody there can attend to you. Don't keep it at home and think that you can do some concoctions and drink and it will vanish. It will resurface. On this note, I wish you a safe, breast cancer-free year. Let's live long. Let's enjoy what God has blessed us with our families so that we can continue to work for Him. I've been doing this discussion with Madam Ophelia Tonto and Dr. Emmanuel Boakye. We want to say thank you so much. God bless you. We are not done with the discussion. We continue next week. This month, we are discussing breast. Take good care of your breast until we meet again. Good night. Bye-bye.